Cervical stenosis means tightening of the spinal canal. And tightening of the spinal canal happens usually from a degenerative nature where the spinal canal becomes tighter and tighter because of bone spurs or disc herniations or disc bulging. And for most people, it's asymptomatic and we don't have to worry about it. But in a certain population, it starts pushing on the spinal cord, and that starts affecting hand function, clumsiness of the hands, balance problems, gait problems where their balance is off when they need more assistive devices such as a cane or a walker to walk. But most common symptoms are hand dysfunction. The things that can happen is numbness of the hands. People have problems buttoning their shirts at times. They sometimes tell me their handwriting is off. It's becoming worse and worse. So it's a very, typically it takes a while for a patient to seek treatment because the pain is usually mild or non-existent. You should seek medical care for cervical stenosis if you find that your hand function is deteriorating, you're dropping things with your hands, you're becoming clumsier with your hands, or your balance is becoming more affected. Or if you start having neck pain and it's just not responding to given the time and taking anti-inflammatories. If you're given a good couple of weeks and you're not getting better, you should come and see either an orthopedist or your primary care physician for a great neurologic examination to see if there's a greater cause for this. If cervical stenosis is presenting as just neck pain, that could be treated with physical therapy, anti-inflammatories, or possibly cortisone shots if it's pretty severe. However, if the stenosis is causing spinal cord compression to the point that it's affecting your hand function, then that typically needs surgical management because it is progressive, and people have progressive deterioration of their hand function, and they lose grip strength, and it starts affecting their balance more and more. So that typically needs to be managed by a spine surgeon. Surgery typically involves going in and taking the pressure off the nerves in the spinal cord to allow for recovery of these nerves. It's usually, for the most part, simple, and most people recover within a day or two.